Assalamualaikum everyone, welcome to my channel MedEasy with Nas. If you are a medical student looking for a simple explanations, helpful study content, make sure to subscribe and join this learning journey with me. Let's make medicine easy together. So our first topic is Introduction to Forensic Medicine. It is based on the CBDC syllabus. So first question is define forensic medicine, medical jurisprudence and describe history of forensic medicine. So there are two distinct aspects of law medicine relationship. First is forensic medicine and second is medical jurisprudence. So first is forensic medicine. Forensic means forum which is used in court of law, deals with the application of medical and paramedical knowledge to aid in the administration of justice. To understand the above definition, we have an example. Just imagine a person is crossing a road. While crossing the road, he may die of coronary thrombosis. Okay, then the dead body or the person is run over by a motor vehicle, and here the driver is charged with a manslaughter or any murder case. Okay, so here comes our role, that the histochemical and biochemical studies of injuries are sustained post-mortemly. An examination of coronary arteries will reveal the presence of disease. So here from this example we learn that we have to apply our medical knowledge to get the administration, to get the truth behind certain murder or crime or maybe it anything. Okay, so there are certain associated definitions such as clinical forensic medicine and state medicine. Okay, so the clinical forensic medicine deals with the medical legal aspects of examination of living human being caused by associated with all types of violence and other causes where legal problems are involved, right? So basically the difference between forensic medicine is and clinical forensic medicine is that the forensic medicine deals with living or dead, but the clinical forensic medicine deals only with the living human beings. Okay, then the state medicine comes. State medicine deals with the legal aspects of practice of medicine, regulating professional activities of a medical practitioner, standards and uniformity of medical education and health requirement of community and environmental health. So the state medicine deals with the legal aspect of all the things that it may be in education sector, maybe in health sector, health requirements or community and environmental health. Okay, now here comes our second definition, that is medical jurisprudence. We have to split the word first, that is juris and prudentia. Juris means law and prudentia means knowledge. So it deals with the legal responsibilities of a physician. Okay, deals with those relationships which are generally recognized as having a legal consequence. For example, doctor patient relationship, doctor doctor relationship and doctor state relationship. In short, it deals with the legal aspect of medicine, right? So first is doctor patient relationship. When a doctor accepts to treat any person, it constitutes an implied contract. Okay, means it overall means that if a doctor is ready to treat a person, he comes under an implied contract to treat the person and make sure that the person should cure in best possible way if it has resulted in either physical or mental injury or monetary loss to the other party. If the doctor fails to do so, then he should face the further consequences. Okay, for example, malpractice, wrong diagnosis and criminal abortion. Okay, so now the second category is doctor doctor relationship. So doctor criticizing his colleague of doing anything that means unfair competition is liable to force the consequence. Okay, so here the name says that doctor doctor relationship, so it is between two doctors. Okay, one doctor is criticizing his colleague. Okay, it sounds like a unfair competition to them. For example, remark on other doctor has given a bad x-ray, or the other doctor has put something wrong, giving something wrong prescription or doing some wrong diagnosis, or manipulating someone. So these are the allegation which one doctor will put to another for his profit, right? So it basically it is a unfair competition and it should not be done. Now, third is doctor state relationship. So a doctor is liable to face the consequences if he does not attend the court to give evidence in response to subpoena. Subpoena is the further topic we will study. If he does not inform the police, if he came across a case of homicidal poisoning or suspected homicidal injuries, state gunshot wounds, etc. So here there are some categories such as like the doctors is liable if he does not attend the court, as the doctor is the main point in medical legal case to serve as the evidence, right? So it comes under this. Or a doctor should inform the police regarding homicidal poisoning. It may be suicidal also. So if the case is suicidal, the doctor has a choice, and he put it to the patient that if he wants to inform it to the police or not. In rape cases, he should take permission with the patient to inform to the police, like that. Then lastly, the definition is forensic pathology deals with the study and application of the effects of violence or unnatural disease in its various form in or on the human body, in determining the causes and manner of death in case of violence, suspicious, unexplained death. So here the forensic pathology deals with the application of effects of violence, means how an injury occurred. Okay, pathology is the study of disease, right? So here we have to apply the pathological findings into get the administration of truth, right?